It's Mother's Day in the UK, and for me it's been a pretty dismal time. I guess boredom has set in, although I have a pretty good life and things are going okay. Despite on the job front, I just wanted to come in today and share some thoughts about surgery and holistic methods. And whilst I think that for me surgery was the way to go, but I don't want to say surgery is the way to go or holistic methods is the way to go, because I would say if you're considering surgery for your problem, gynaecological problem, it's best to always consult your medical practitioner, because they will be in the best position to advise you. But I just want to give you the pros and the cons for both of the scenarios and share a little bit of a story with you. So while Sunday is not supposed to be my content creating day, I felt a little bit bored, as well as I felt like, why not put something out there on surgery versus holistic? So let's go. Grab your favourite cup of coffee or drink, or even your favourite drink, and let's go. Let's get started. So for me, I suffered for 15 months with a large fibroid. A fibroid being a pelvic mass. There's many names for it. And pelvic tumour. But I suffered for 15 months. And during those 15 months, my pelvic tumour was at its peak. So my one was about approximately 10 centimetres. I don't know how it is in size 10 centimetres, because they say fibroids can be the size of a small grapefruit. They say fibroids can be a size of a pea, but my one was 10 centimetres. It was that large, it was actually protruding from my abdomen. And when I was working at the time in the custodial industry, and I went to another custodial industry, I didn't want to wear certain things because my trousers at the time couldn't go around my waist properly because of this thing sticking out. And for me, once I got seen by the doctors and they explained a little bit about surgery, I was all inclined to go for surgery, because I just wanted to live the best and normal life. So for me, surgery was the option. But again, my friend, kudos to her, she just mentioned one word, holistic. And she didn't go into details at the time, but she said this word, and I, being me, and I like to find out more about things because I've got an inquisitive mind, I looked up holistic methods, and I looked up some video on a YouTube channel. I can't remember the name right now, but the person talked about castor oil packs. And for me, once finding this, and once I got this particular holistic treatment, so to speak, I started doing it sometimes 3 times a week. And for me, it was amazing because it was a game changer. I found that immediately the tension that was in my stomach area, lower abdomen, the left side, that I was feeling from this mass was slowly easing, and I started to feel great. So I would say yes, holistic methods do work, and it may take a longer time to ease one's fibroid or one's gynaecological situation, but for me, when I tried it, over a couple of weeks, I was slowly feeling less tension in that area, in my stomach area. Maybe the stomach area was being relaxed. And again, I am not a medical expert, but I'm just sharing my thoughts on things that I did in my life to ease my pain during that time of my gynaecological experience. So yeah, it was absolutely amazing. But when it came down to, I would say late 2020, I would say when it came down to late 2019, and I saw my surgeon just before my surgery, and he told me everything that was going to happen, and he went more in depth with the procedures. I started getting a little bit anxious, and he told me that I would have to take some medication to shrink the fibroid a bit, because my fibroid was so large I couldn't have the keyhole surgery. I had to have an open surgery because of the size of it. So I got worried because he told me that I had to take Prostrep injections, and I know that Prostrep injections is usually used for cancer patients, but I followed his advice, and I'm quite good to follow experts' advice. And as the days and the months were going, and it got to 2020, I was getting a lot more nervous about the surgery, and even in my mind, I didn't expect when the surgery day came and I came through surgery on the 10th of March 2020, I didn't expect to be here. I didn't expect to be in the world today. And when I woke up, one of my first thoughts were, because I was seeing things around. I didn't expect to see things around. I expected to see something different. I expected not to be there. So that, I would say, is one of the major risks of surgery, and particularly a major surgery. One can experience passing away. The next risk, I will say, my top 3 I will give, is that surgery can have its complications. For me, touch wood, I didn't have any complication, but the surgeon had to give me the pros and the cons, because my type of surgery of a myomectomy, it can be very messy. My surgeon used another word, but I don't really want to use that word at the minute, but he said it can be bloody. But yeah, so, and when I went through the surgery, he said if it is life-threatening, then we'll opt for a hysterectomy. And I was praying, folks, everyone, that I didn't have to go through that, because I don't have a dependent yet, and I want to be able to have a dependent one day, and I want to be able to have my own little unit. So yeah, that was another thing, that if you're considering going through this type of surgery, that it is quite messy, and depending on your situation and your size of your pelvic mass, fibroids, it can be a little bit tricky. And another point about surgery is that you may have to adjust your lifestyle. And why I brought this point up is because it has taken a little bit of toll on me, it personally, because whilst I chose the decisions I wanted for my life going forward, and I chose to leave my previous job, but if you have a career and you've built yourself up to a certain level after surgery, it may be that you may not want to do the things you once did in your previous time before your illness, before your surgery. So that is a big thing to consider, because it will affect your health, it will affect your mental well-being as well. And whilst I know that I will get a career one day, and I do expect to get a good career one day, it's just that little bit of a wait, and it's just being patient with oneself. And I am pleased to say I am just past, I am a year after surgery, and so far things have gone great, and I've been more mindful of what I've been doing, and it's been absolutely amazing. But I would say, for me as a patient, advising you and instructing you and enlightening you, if you like to say, that consider these points, because it is a life-changing thing. And always consult your medical practitioner as well. And now I am talking on the fly, to be honest with you. I have done research in this field, and if you want more advice and a little bit more factual information from me as a patient, you can always check out my podcast show. It's called An Audio Diary, A Personal Health Journey, and it's on Spotify, Amazon Music, Stitcher, Google Podcasts and Apple Podcasts. Those 5 platforms at the minute. But yeah, and I think I've talked extensively about surgery, and I've given you one point that I think holistic methods could be great. The other point with holistic methods is that it can take a longer process rather than having surgery for something, and it maybe take a quicker time for you to get over your situation or health situation. I said that twice. Yeah, I'm getting hungry, folks. But yeah, it can take a longer time to get over your current illness. Depends on what you're going through in your life. You may want to ease your problem and ease your pain, like I wanted to ease my pain as soon as possible, because during those 15 months that I had this particular thing, those were the 15 months which was the most detrimental to me, because my health, my well-being, my relationships, a lot of things suffered, and surgery was the best option for me because of the size of my pelvic mass, my fibroid. So always consult your medical practitioner and advisor. And yeah, but I am grateful and so blessed that I went through the surgery today. I'm grateful because God was watching over me, and whilst I'm not going to preach, and although I am a Christian, but I'm not going to preach or say anything, because I understand that everyone's in a different situation, and you may not be a believer, but you may have some faith. But yeah, I'm so grateful that God was there, and I'm just so happy to be alive and be well and achieving my best life, and trying to educate and enlighten more women to what the possibilities are. And with that, friends, I am going to go and get some dinner now, because time is getting later, and I'm going to relax and enjoy my Sunday. I hope you all are having a wonderful Sunday, the 14th of March. If you are in the UK and it's Mother's Day and you are a mother, or if you've had an unfortunate experience and your mother is no longer here, condolences for your loss as well. But if you are a mother and you're celebrating Mother's Day, happy Mother's Day to you. yeah, I'm kind of running out of things to say here. So, bye for now, and I'll see you later.